A depressing and now familiar pattern. Elderly with underlying health conditions. The sixth and latest UK coronavirus death, this time coming here in Watford. The rising numbers have today again prompted questions about Britain's capacity to cope.
Well, of course we have to plan for a reasonable worst-case scenario, but we're working incredibly hard to avoid that scenario.
But according to Jonathan Ashworth, Mr Hancock's opposite number, the government's assurances lack detail. He has asked repeatedly for exact critical care capacity figures.
I think we need absolute clarity from the government on the number of intensive care beds that are available, the number of oxygen ventilators that are available, and the number of these very high-end specialist ECMO beds that are available.
ECMO beds are used only for the most critically ill patients. After the 2009 swine flu epidemic, the government was recommended to double its capacity. NHS England has told Sky News it now has over 30 of these beds, significantly more than the original 5. To understand what might happen here, the government is following developments in Europe, where cases continue to surge. The number of cases in Italy rocketed from the hundreds to the thousands in just a few weeks, and the same thing is expected to happen here. Their healthcare system was completely overwhelmed, but is their critical care capacity greater than ours? NHS England has just over 4,000 adult critical care beds. That's around 7 beds for every 100,000 people. That's way behind Germany and France and even Italy, which has almost double. But around 75% of England's critical care beds are currently full. London has the highest occupancy in England at 78%, with the lowest in the eastern region at 68%. While the UK's other nations are in a worse position, 95% of critical care beds in Northern Ireland and Wales are full, and 84% in Scotland. The government says the NHS is prepared and ready to cope with the worst case scenario. But everyone is hoping that it never has to. Ashish Joshi, Sky News.